Thank you for staying with CNN. One life, two diseases, one response. That's the message that will dominate next week's global forum on HIV, the virus that causes AIDS, and tuberculosis, or TB. These two infections can work to shorten the life of the person infected with both. And UNTV has more on the HIV-TB connection.
Every 3 minutes, a person living with HIV dies of tuberculosis. We need bold leadership for scoring a great goal, save the lives of many people.
International soccer star Figo lending his voice to calls to address the deadly mix of HIV and tuberculosis. The message may be lost on these London school kids, but to the global leaders attending the first ever forum on HIV and TB, the message is clear, that the deaths of nearly 250,000 people with HIV every year can and must be prevented. Figo's message certainly resonates here in Brazil, a country where football is worshipped and TB and HIV is feared. Today, in some districts, HIV tests are routinely offered to anyone with TB symptoms, and lung examinations are carried out on all registered AIDS patients. But the quality of these services varies widely across the country. Such challenges are not unique to Brazil. The dual threat of TB and HIV is a massive global problem, and a global forum on the 9th of June will speed the process of making HIV and TB a political priority. Among the leaders is the head of the World Health Organization, who reminded health ministers recently that progress must continue.
The forum takes place at a time when several high-burden countries are showing very promising increases in the number of people accessing integrated HIV-TB services. Leadership can take this momentum a step further.
Ministers attending the World Health Assembly here in Geneva have been hearing the message that addressing the HIV-TB co-epidemic is a priority and that is also very feasible. And that same message will be relayed back to their prime ministers and their presidents. UNTV's Glenn Thomas for CNN World Report.
But over and over again we see the overlap between HIV and TB, which is, has already been said, the #1 killer of people living with HIV. In some nations in Africa, almost 3 in 4 people who have tuberculosis also are infected with HIV. It is the #1 killer of AIDS patients now, and it no longer makes any sense for us to be asking any people anywhere in the world, but especially in the most severely affected countries, to pursue 2 different opportunities to find out whether they're infected with 2 different diseases, to see 2 different doctors or medical workers, go to 2 different pharmacies, have 2 different strategies. Some progress has been made here. There are now 30 times as many people with TB being tested for HIV as there were in 2002. That's the good news, and for all of you who've been involved in that, I'm grateful. But we have to do a better job of fighting the 2 diseases with one approach, designing our work around the realities of the patients that are treated.
In less than 6 years, the Global Fund has become the primary multilateral funder of the fight against the 3 diseases. It has already committed $2.2 billion for TB programs and close to $9 billion for HIV programs in 133 countries, including the 22 countries with the highest TB burden and all countries with the highest HIV epidemic. Global Fund grants now provide 2/3 of global financing for TB and more than 20% of global financing for HIV programs. As Mark Dybul just said, PEPFAR, the US Presidential's Initiative on AIDS, the other major funder for AIDS, is also devoting now significant funding for TB. And there are indications that the availability of Global Fund grants has led to a revitalization of domestic TB programs and funding and has leveraged an increase in domestic funding. Global Fund supported programs have allowed more than 3.9 million people with TB to be treated under DOTS and 1.7 million people to access ARVs.
So hi, we're here on behalf of 205 civil society organizations from 65 countries around the world that have signed a letter to you all and to the governments around the world, asking for 4 key demands as networks of people living with AIDS, networks of people living with TB, networks of advocates and activists around the world. And so we're here with 4 pieces for you today. The first is, and we submit and ask that everyone bring this forward into the high-level meeting as an official submission from civil society when it comes to TB and HIV. The first piece is that we demand that governments immediately and publicly announce universal access to high-quality TB, HIV care by 2015. By 2015, in high-burden areas, every person living with HIV should be screened for TB. Every person living with TB should be offered HIV counseling and testing. And treatment, prevention, and care must be universally available and coordinated for both diseases. This must be coordinated with a scale-up to universal access on HIV by 2010. Number 2, full funding. Donor and high-burden countries or governments must announce specifically how they will fund the at least $19 billion that will be needed between now and 2015 to address HIV and TB specifically together. This is needed to ensure high-quality TB HIV care is available to all co-infected people and that new tools are on the way.
Number 3, we would want all the people noted here to address the issues of reducing TB, HIV mortality. Country plans should monitor progress to reduce mortality to no more than 90,000 by 2010 and 50,000 by 2015, an 80% reduction over our current costs. And number 4, 21st century diagnostics and treatment. We need a tangible global commitment which must be announced to developing and ensuring access to 21st century diagnostics and treatment tools so that co-infected people are screened and treated more effectively.